Many older adults in their 60s, 70s, and 80s believe that stroke comes out of nowhere. One day you are at home, cooking, watching television, or talking on the phone. The next moment you are in the hospital, and everything has changed. It feels sudden, frightening, and completely out of your control. But in many cases, stroke is not as sudden as it seems. For days, and sometimes for a few weeks, the body often tries to send quiet warnings. The brain and the blood vessels begin to struggle, and small changes start to appear. The challenge is that these early signs are easy to blame on other things. In the middle of daily life in the United States, with family, appointments, finances, and medications to manage, it is natural to say, "I am just tired," or "that is just my age," and keep going. Imagine a very ordinary morning. You wake up and your head feels heavier than usual. You slept your usual number of hours, but you do not feel truly rested. You walk from the bedroom to the kitchen and notice a brief moment of lightheadedness. It passes quickly, so you brush it off. You sit down with your coffee, and for a few seconds the hand holding the cup feels slightly numb or tingling, then it settles down again. It is easy to tell yourself, "I must have slept in a bad position," or "the weather is bothering me today," and move on. The next day you feel unusually tired again, somewhat sleepy all day, but you push through it. These small moments seem too minor to worry about. Yet sometimes they are the brain's quiet way of saying, something is not right. Please pay attention. In this video, we will talk about 5 early warning signs that often appear in the 30 days before a stroke. Not everyone has all 5 signs, and having one of them does not mean you will certainly have a stroke. However, knowing what these signs look and feel like can help you notice when your body is asking for help. When you recognize them early, you have a better chance to check your blood pressure, talk with your healthcare provider, adjust your treatment if needed, and protect your brain before a major event occurs. This video is not meant to frighten you or to make you diagnose yourself. It is here to give you clear, simple information so you can make safer choices. When you understand these signals, you will have a better sense of when rest is enough, when you should check your numbers, when a phone call to your doctor is wise, and when it is time to go straight to the emergency room. What we share is for education. It cannot replace the advice of your own healthcare provider, who knows your medical history and your medications. But it can be a helpful first step in watching over your own health and in caring for the person who shares life with you. As you listen, if you notice that some of these signs sound like things you have been feeling recently, you are welcome to write a few words about it in the comments. Sometimes putting your experience into words helps you see it more clearly, and your story may also help another older adult realize they are not alone. If you find this kind of information useful and easy to follow, you can subscribe to this channel so that each week you receive gentle, practical guidance about stroke, blood pressure, heart health, memory, and staying as safe and independent as possible after 60. On paper, early warning signs of stroke can sound very medical and distant. In real life, they often slip quietly into ordinary days, mixed in with familiar routines. That is one reason they are so easy to ignore. You might notice that getting out of bed in the morning feels a little different. As you stand up and walk toward the bathroom or the kitchen, there is a brief feeling of lightheadedness or unsteadiness. It passes quickly, so you tell yourself it is nothing. Later, while you are holding a coffee cup, a spoon, or the television remote, your fingers or part of your face feel slightly numb or tingling for a few seconds. Because it goes away on its own, it is easy to blame your sleeping position, a stiff neck, or the air conditioning. On another day, you wake up after what seems like a full night of sleep but feel unusually drained. Your body feels heavier, your mind is slower, and you find it harder to focus on simple tasks like reading the mail, following a television show, or planning a meal. Instead of feeling refreshed, you feel as if your energy never quite arrived. It is natural to think, this must just be age, and keep pushing through the day. Sometimes the signal shows up through your eyes. You may open your eyes in the morning and notice that one side of the world looks a little blurry, or that objects seem doubled or slightly out of line. You blink a few times, rub your eyes, and things clear up. Because it comes and goes, you may decide it is just dry eyes or a need for new glasses and put it off. If you check your blood pressure at home or at the pharmacy, you may also see numbers that are much higher than usual on some days and lower than expected on others. You might feel your heart beating harder, notice a warm flush in your face, or a tight, heavy feeling across your shoulders and neck. Once again, it is easy to connect this to stress, the weather, or a busy week and leave it at that. Each of these moments alone can seem small and harmless. But when they are new for you, when they repeat over several days or weeks, and especially when more than one shows up in the same period, they may be part of a larger picture your body is trying to draw. To make sense of these small changes, it helps to have a simple picture of what is happening inside your body. A stroke happens when part of the brain suddenly does not get enough blood and oxygen. This can occur because a blood vessel is blocked, or because a weakened vessel breaks and bleeds. The brain cannot store oxygen for later, so when the blood flow drops, even for a short time, brain cells begin to struggle. Long before a stroke, many people already have changes in their blood vessels. With age, and with conditions like high blood pressure, diabetes, high cholesterol, and heart disease, the walls of the arteries can become thicker and stiffer. Fatty deposits can build up inside. The pressure inside the vessels may go up and down instead of staying steady. You cannot see or feel these changes directly, but the body often sends messages on the surface. A strange, new headache that lasts for days can be one of those messages. When the blood vessels that supply the brain tighten or narrow, the blood may not move as smoothly as before. Structures around the brain that are sensitive to pressure and tension react, and you feel a dull, heavy ache, sometimes worse when you bend over or turn your head. It is not the same as a usual sinus headache or the kind of pain you get when you miss a night of sleep. It is the circulation to the brain saying, "I am under strain." Brief tingling or numbness in the face, hand, or arm can be another message. For a few seconds or minutes, the blood flow to the area of the brain that controls feeling and movement may dip. When the flow returns to normal, the symptoms disappear, which makes them easy to dismiss. But to the brain, it was a small warning rehearsal of what could happen if a vessel closes off more completely. Unusual tiredness and daytime sleepiness, even after what seems like enough sleep, can also be related to reduced blood flow and oxygen to the brain over time. When the brain does not receive what it needs, it may still work, but with less energy and clarity. You feel slower, less focused, and as if your mental battery never charges all the way. Changes in vision, brief blurring, double vision, or flashing lights, can signal that the vessels feeding the eyes or the part of the brain that handles sight are not getting steady blood flow. And when blood pressure jumps up and down, the vessel walls, especially in the brain, are repeatedly pushed and stretched. Over time, that makes them more fragile and more likely to leak or clot. Not every headache, tired day, or episode of blurry vision means a stroke is coming. These symptoms can have many causes. What matters is the pattern, new, different, repeated signs in an older adult, especially someone who already has high blood pressure, diabetes, high cholesterol, or heart problems. When you see that pattern, it is wise to treat it as a serious message rather than a minor annoyance. Now let us look more closely at 5 early warning signs that often appear in the month before a stroke. Remember, not everyone will have all 5, and each sign can have other causes. What matters most is when these changes are new for you, keep coming back, and appear together with your other health risks. The first warning sign is a new, unusual headache that lasts for days. Many older adults know what their usual headaches feel like, such as sinus pain with a cold or a dull ache after a poor night's sleep. This is different. This kind of headache often feels like a steady, heavy pressure that hangs on for 2 or 3 days or longer. It may get worse when you bend over, turn your head, or stand up quickly. You may take pain relievers that used to help, but this time the relief is limited or temporary. You might also feel a sense of heaviness in your head, or a slight feeling of being off balance. This type of headache can be a sign that the circulation to the brain is under strain. It does not mean a stroke is certain, but it is not something to ignore, especially if it is new for you and you already have high blood pressure or other risk factors. The second warning sign is brief numbness or tingling in the face, arm or hand, often on one side of the body. It may feel as if part of your lip, cheek, or fingers fell asleep for a moment and then woke up again. Each episode may last only seconds or a few minutes, and then you feel completely normal. Because it passes so quickly, it is very tempting to blame the way you were sitting or lying down. However, these short episodes can be small warnings that the blood flow to a part of the brain is being reduced for a brief time. Doctors sometimes call this a mini stroke, or a transient ischemic attack. The brain recovers for the moment, but the message is important. The blood vessels are not as stable as they should be. If you notice this kind of brief numbness or weakness, especially if it repeats or affects the same area, it is important to tell your healthcare provider as soon as possible, or seek urgent care if it is happening right now. The third warning sign is unusual tiredness and sleepiness during the day, even when you believe you have slept enough at night. This is not the normal feeling of being worn out after a busy day or staying up late. Instead, you wake up from a full night's sleep and still feel as if you have not truly rested. Throughout the day you may feel as if your body is heavier, your thinking is slower, and it takes more effort to do ordinary tasks like dressing, preparing a meal, or paying attention to a conversation. You may find yourself wanting to sit down or close your eyes more often than usual. Many people simply say, "I am getting older," and leave it at that. But when this change comes on over days or weeks, without a clear reason such as a new illness or big life event, it may be a sign that your brain is not getting the steady supply of blood and oxygen it needs. If this kind of tiredness is new for you and seems to be getting more frequent, it is worth discussing with your doctor, especially if it comes along with any of the other signs we are talking about. The fourth warning sign is sudden changes in vision. This can include brief blurring in one eye, seeing double, or noticing flashes of light or dark spots that were not there before. You might be reading, watching television, or just opening your eyes in the morning when you realize that something is off. After a short time, your vision may return to normal, and that can make it easy to blame dry eyes, old glasses, or the lighting in the room. For someone with high blood pressure, diabetes, or other circulation problems, these short episodes can be a sign that the blood supply to the eye or to the part of the brain that controls vision is being disturbed. Of course, many eye problems are not related to stroke at all, but because vision is so important and because the eyes and the brain are closely connected, sudden, unexplained changes should always be taken seriously. Telling both your eye doctor and your primary doctor about these episodes can help them decide what kind of testing or follow-up is needed. The fifth warning sign is blood pressure that swings up and down instead of staying in a steady range. If you check your blood pressure at home or at a pharmacy, you may notice that some readings are much higher than your usual numbers, while others are lower than you expect. Along with these changes, you may feel your heart pounding, notice a warm flush in your face, or feel a heavy tightness across your shoulders and neck. Sometimes you may not feel any different at all, but the numbers on the screen tell another story. When blood pressure rises and falls sharply, the walls of the arteries, especially in the brain, are placed under repeated stress. Over time, this can make them weaker and more likely to form clots or to leak. If you see a pattern of high or highly variable readings, it is safer not to adjust your medication on your own. Instead, write down the numbers, the times you took them, and how you felt, and bring that record to your healthcare provider so you can review it together. None of these 5 signs, by themselves, prove that a stroke will happen. They are not meant to make you anxious about every small symptom. Their value lies in the pattern they form, especially in an older adult who already has conditions like high blood pressure, diabetes, high cholesterol, or heart disease. When you notice that pattern, your body is not trying to scare you. It is asking you to slow down, pay attention, and seek help sooner rather than later. At this point you might be wondering, does this mean that every headache or tired day means a stroke is coming? The answer is no. Health is never that simple. The same symptom can have many different causes, and most of the time these signs are not followed by a stroke. But from a doctor's point of view, there are 2 things that matter very much: your age and your overall risk. When someone is in their 60s, 70s, or 80s and already has high blood pressure, diabetes, high cholesterol, or heart disease, the body's small signals deserve more respect than they usually get. When doctors talk with patients who have just had a stroke and ask about the weeks before it happened, many stories sound alike. People remember new headaches that did not feel like their usual ones, moments of numbness or weakness that came and went, days of unusual fatigue, brief changes in vision, or blood pressure readings that were all over the place. At the time, almost everyone had a reasonable explanation: stress, weather, poor sleep, getting older. Only afterward did they realize that their body had been trying to get their attention. That is why many doctors wish their patients would treat new and repeated symptoms not as just age, but as information that something might be changing inside. From a medical point of view, 3 practical habits make a big difference. The first is checking blood pressure regularly. High blood pressure that is known and well controlled is very different from high blood pressure that quietly goes up and down without anyone noticing. The second is writing things down. A short note about when your symptoms started, how often they occur, and how they feel can tell your doctor far more than a vague memory of "sometimes I feel off." A small notebook with a few lines each day can be as helpful as a test result, because it shows a pattern over time.
The third habit is not waiting too long.
If something new starts and keeps repeating over days or weeks, bringing it up sooner gives your healthcare provider more time and more options to help you. It is also important to remember that there is a difference between early warning signs and an emergency. The signs we have talked about here are often scattered through the days and may come and go. They are a reason to pay closer attention, to track your numbers, and to speak with your doctor. But if you or someone near you suddenly has a drooping face, weakness in one arm or leg, trouble speaking clearly, or trouble seeing on one side, that is not the time to wait, write it down, or call for an appointment later. That is the time to call emergency services right away. In that situation, every minute truly counts. The information in this video is meant to help you understand your body better and to prepare you for a good conversation with your healthcare provider. It cannot replace an examination or professional advice that is tailored to your own medical history. Still, if there is one message that many doctors would want older adults to remember, it is this: do not dismiss new repeating changes in your body as just getting older, especially when you already know you have risk factors for stroke. Paying attention to those small signals today may be one of the most important steps you can take to protect your brain and your independence in the days ahead. After hearing about these warning signs and what may be happening inside your body, the most important question is what you can do next. The good news is that your action plan does not have to be complicated. A few simple habits, done regularly, can make a real difference. One helpful step is to start paying closer attention to any new or unusual symptoms and to write them down. If you notice headaches that are different from your usual ones, brief spells of numbness or tingling, unusual tiredness, short episodes of blurred or double vision, or days when you simply do not feel right, take a moment to note it. You can use a small notebook or a sheet of paper you keep in the same place every day. Write the date, roughly what time it happened, what you were doing, and how long it lasted. You do not have to write a long story. Just a few clear lines are enough. Over time, this simple record can help you and your healthcare provider see whether something is happening once in a while or repeating in a way that deserves more attention. Another key step is to check your blood pressure regularly, if possible. If you have a home blood pressure monitor, choose 1 or 2 times a day when you are usually calm, such as after you wake up and later in the evening, and make those your regular measuring times. Sit quietly for a few minutes before you take the reading, and then write the numbers next to that day's notes about symptoms. If you do not have a monitor at home, you may be able to use one at a pharmacy or clinic. Over days and weeks, this will give you and your doctor a clearer picture of how stable or unstable your blood pressure really is. A third important step is to reach out to your healthcare provider sooner rather than later if you notice a pattern. If you have several days or weeks with repeated new headaches, numb spells, unusual fatigue, changes in vision, or very uneven blood pressure readings, that is a good time to call the office and ask for an appointment or at least for advice. When you call, mention that these are new symptoms for you, that they have been repeating, and that you have been writing them down. Bringing your notebook of symptoms and blood pressure readings to the visit can give your provider valuable information and help guide decisions about testing or adjusting your treatment. At the same time, it is important to know when the situation is urgent. If you suddenly notice a drooping face, trouble lifting one arm, weakness in one side of the body, difficulty speaking clearly, or sudden loss of vision on one side, that is not the moment to watch and wait. In that case, calling emergency services right away is the safest choice. Emergency care teams are trained to move quickly when stroke is suspected, and getting help fast can make a major difference in how much of the brain can be protected. Alongside these steps, keeping up with regular checkups, recommended blood tests, and any heart or circulation evaluations your provider suggests can also help. The goal is not to turn your life into a series of appointments, but to make sure that conditions like high blood pressure, diabetes, and high cholesterol are being watched and managed as well as possible. After hearing about these warning signs and what may be happening inside your body, the most important question is what you can do next. The good news is that your action plan does not have to be complicated. A few simple habits, done regularly, can make a real difference. One helpful step is to start paying closer attention to any new or unusual symptoms and to write them down. If you notice headaches that are different from your usual ones, brief spells of numbness or tingling, unusual tiredness, short episodes of blurred or double vision, or days when you simply do not feel right, take a moment to note it. You can use a small notebook or a sheet of paper you keep in the same place every day. Write the date, roughly what time it happened, what you were doing, and how long it lasted. You do not have to write a long story. Just a few clear lines are enough. Over time, this simple record can help you and your healthcare provider see whether something is happening once in a while or repeating in a way that deserves more attention. Another key step is to check your blood pressure regularly, if possible. If you have a home blood pressure monitor, choose 1 or 2 times a day when you are usually calm, such as after you wake up and later in the evening, and make those your regular measuring times. Sit quietly for a few minutes before you take the reading, and then write the numbers next to that day's notes about symptoms. If you do not have a monitor at home, you may be able to use one at a pharmacy or clinic. Over days and weeks, this will give you and your doctor a clearer picture of how stable or unstable your blood pressure really is. A third important step is to reach out to your healthcare provider sooner rather than later if you notice a pattern. If you have several days or weeks with repeated new headaches, numb spells, unusual fatigue, changes in vision, or very uneven blood pressure readings, that is a good time to call the office and ask for an appointment or at least for advice. When you call, mention that these are new symptoms for you, that they have been repeating, and that you have been writing them down. Bringing your notebook of symptoms and blood pressure readings to the visit can give your provider valuable information and help guide decisions about testing or adjusting your treatment. At the same time, it is important to know when the situation is urgent. If you suddenly notice a drooping face, trouble lifting one arm, weakness in one side of the body, difficulty speaking clearly, or sudden loss of vision on one side, that is not the moment to watch and wait. In that case, calling emergency services right away is the safest choice. Emergency care teams are trained to move quickly when stroke is suspected, and getting help fast can make a major difference in how much of the brain can be protected. Alongside these steps, keeping up with regular checkups, recommended blood tests, and any heart or circulation evaluations your provider suggests can also help. The goal is not to turn your life into a series of appointments, but to make sure that conditions like high blood pressure, diabetes, and high cholesterol are being watched and managed as well as possible. By now, you have seen that in many cases stroke is not completely out of the blue. For many older adults, the body sends small signals in the days and weeks before a major event. A new kind of headache that lingers, brief spells of numbness or tingling, unusual tiredness that will not lift, sudden changes in vision, and blood pressure readings that jump up and down are all ways your brain and blood vessels may be asking for attention. On their own, each of these can seem minor. Together, especially in someone who already has high blood pressure, diabetes, high cholesterol, or heart disease, they form a picture that should not be ignored. The most important idea to remember from this video is that paying attention to these patterns is not about living in fear. It is about giving yourself the best chance to act early. Instead of shrugging off new repeated symptoms as just aging, you can choose to notice them, write them down, check your blood pressure more regularly, and bring what you see to your healthcare provider. In many cases, this simple shift in how you respond to your body's messages can open the door to better treatment, better control of risk factors, and a lower chance of a serious stroke. The small signals you notice today may be the reason you are able to stay safer and more independent in the years ahead. If, while watching this video, you realize that some of these warning signs sound familiar, you are welcome to share a little of your experience in the comments. You do not have to give many details, but even a short note such as "I have noticed these headaches," or "I have seen my blood pressure jump around," can help you and others see that these issues are real and worth talking about. Your story might encourage another older adult to check their numbers, call their doctor, or go to the emergency room when it truly matters. If you found this explanation clear and helpful, and you would like more guidance like this about stroke, blood pressure, heart health, memory, sleep, and other topics that matter after 60, you can subscribe to this channel and turn on notifications. That way, each week we can spend a little more time together learning simple, practical ways to understand your body and protect your health. Thank you for being here and for taking the time to learn about these early warning signs. Simply by watching this far, you have already shown that you are willing to care for yourself and to pay attention to what your body is trying to say. After this video ends, you might take a quiet moment to think about how you have been feeling lately, whether any of these signs have appeared, and whether it is time to start that small notebook or to speak with your healthcare provider. Those are not small steps. They are powerful choices that can help you look after your brain, your independence, and your future.